Flossing or mobilizing nerves could be useful to decrease neurological symptoms from pinched nerves or, well, in any way bothered nerves, more or less. If they're pinched by herniated discs, if they're pinched or squeezed or poked by muscles, regardless. Floss, mobilize, get them moving, and they might be less bothered. So for the arms, we do something like this. This is a more or less stretched median nerve. If I tilt my head over here, I'll stretch it even further. So this could be used as a test. If this really bothers some sort of sensation or even pain in my hand, it's likely to think that the nerve is bothered by something. You may or may not know what's bothering the nerve. It's likely useful to know what's bothering it, so do your best to get that knowledge in some sort of way. Ask a physio or, well, test things. Compressing nerves in the neck like this, rotation, and then just getting back here. Could test in a decent way if it's really close to the neck and, well, kind of neck related pinching or irritation. If that bothers the same pain, kind of likely that you're bothered in either joints, muscles, or discs in the neck. But let's focus on the flossing itself to reduce the pain and, well, perhaps tingling or lack of motor skills, sensation, feeling, whatever. The point is to do some sort of flossing motion. So stretch it over there and shorten it over here. Stretch, shorten, shorten, stretch, and so on. A bunch of times. Stretching in both directions, testing to just find your fault, problem, and trouble, and then shorten, stretch. That's for the median, the ulnar. So that's stretched. Stretch as well to floss, shorten, stretched, shorten, stretch. And the radial. Fist. Something like that. Stretched. Shorten. And the point is, do 10, 15, 20, and you'd like the symptoms to decrease. You don't want to annoy it even more because, well, just getting more symptoms doesn't really help and it's not comfortable. So do a bunch, do enough to make the symptoms decrease, stretch stuff enough to get something to happen, but don't just keep testing and expect it to calm down, because the point of testing is to annoy and provoke the nerve. So flossing to make it better, testing to annoy to make you really sure that I'm on the right track, I'm doing the right thing. Do a bunch, let the symptoms decrease.